course. Very exciting. And I was given medical advice by Dr. Burks. So she said, coughing is not considered, a minor symptom necessarily. So I should get rid of the cough. So working on getting rid of the cough.
I got the background on.
Yay, that was great, Bill. Good work.
I'm impressed, Bill.
I know, I don't have it.
I'm waiting for Chair Pepe to get his on.
I know, I need the file.
Mayor Levine Cava, just before you start, did Dr. Burks tell you to extend your isolation then? Is that what you're saying?
No, she said that that I needed to get rid of my cough. That's what she said. Is that part of, yes. So I'm going to get rid of my cough.
Before you return to work, before you return to interact.
Before I circulate. Right.
Commissioner Higgins, can you hear me?
Yes.
Congratulations, by the way.
Oh, thank you, Mayor.
That's Carlos.
How you doing, sir?
Did I miss something?
I don't know.
Or is that old news? Okay.
Listen, Commissioner Higgins, by the way, I spent the whole weekend. My daughter's going to be moving over to Brickell, so I guess there's another voter over there.
She can send all of her constituent questions and complaints to my office.
Ay, Carlito.
We were all weekend over there. She's looking at an apartment because she's going to be working for a law firm there. So she's going to be walking from the law firm. So that's going to be pretty cool.
Very good. Okay, Rachel,
I'll call you later
to
if I know how much you're out.
I don't want to hear about it, bro. Please.
I think we can go ahead and get started.
Go ahead, Mayor. I'm sorry. Go ahead.
Okay. All right, everybody call to order.
Thanks, Mayor. So I'll just quickly run through the speaker order and then we'll go ahead and get started. So first we'll have remarks by Mayor Levine Cava in English and Spanish. We'll have our Chairman-elect Jose Diaz speak. And then Miami-Dade Public School Superintendent Alberto Carvalho, Miami-Dade Chief Medical Officer Dr. Peter Page, City of Miami Beach Mayor Dan Galber, City of Hialeah Mayor Carlos Hernandez, from the City of Miami Commissioner Ken Russell, and then President and CEO of the Convention and Visitors Bureau, Bill Talbert, President and CEO of the Greater Miami and the Beaches Hotel Association, Wendy Kalergis, and the Beacon Council President and CEO, Michael Finney, to close us out. And then we'll take questions and have our Creole translator at the very end. Thanks so much again, and I'll hand it over to Mayor Levine Cava.
Thank you, Rachel, and thank you everybody for joining us here today. Many of you are repeaters coming back for the many press events that we've held in the last few weeks. And today we're very excited to be officially launching a new campaign called We Can, We Will. And this is to keep our residents safe, especially during this holiday season. And I have always said our response to the pandemic must be a unified protection plan across all levels of government and across all of our community leadership. And I am so proud that this campaign has brought together so many great leaders across our community. We Can Adapt and We Will Thrive is a collaborative communications effort by my administration, county departments, elected leaders, business groups, health leaders, and residents to share positive messaging about the safety measures that will help us prevent the spread of COVID-19. We will celebrate our residents and we will celebrate our residents and our businesses that are doing the right thing, and we will motivate our community to enjoy our beautiful parks and open spaces during the holidays. We'll be working closely with all of the partners on this call and across our community to share this new message across the whole community. So new resources are now available on miamidade.gov/wecanwewill in English, Spanish, and Haitian Creole. So over the next few days and throughout the holidays, we will be sharing short videos with community leaders that will share their own stories about how they've adapted to these new circumstances in order to thrive. And we encourage the whole community to check out the site, download the resources, and share their own stories online. And another key piece of this campaign is to ensure that all our residents have the resources that they need to stay safe. So this week, our county police department stepped up to the plate and began handing out masks to our residents. Small actions like this one, wearing a mask and making sure those around you have a mask to wear, those are the centerpieces of this campaign and how we will keep our communities safe. So as we head into the holidays, coronavirus cases are rising across Miami-Dade, and what we all do now will make a difference. I invite you to join us in our campaign by sharing your own messages with the community using the hashtags We Can, We Will, and Podemos Lo Haremos. So thank you again, everyone, for joining us here today. I'm looking forward to working with all of you and here and to help Miami-Dade County ensure that we stay safe this holiday season so we can move safely together into 2021. Y en español. Gracias a todos por acompañarnos hoy en el lanzamiento oficial de la campaña Podemos Adaptarnos, Saldremos Adelante del condado de Miami-Dade para proteger a nuestros residentes durante esta temporada. Debemos tener un mensaje unidos para salir de esta pandemia y me enorgullece que esta campaña haya reunido a tantos líderes de toda nuestra comunidad. Podemos adaptarnos, saldremos adelante. Es una colaboración de mi administración, líderes electos, grupos empresariales, líderes de salud, líderes comunitarios y residentes para compartir mensajes sobre las medidas de seguridad para prevenir el COVID-19, celebrar a los residentes y las empresas que hacen lo correcto y motivar a nuestra comunidad a disfrutar de nuestros hermosos parques y espacios abiertos durante las vacaciones. Durante los próximos días lanzaremos una serie de videos con líderes comunitarios y los residentes pueden visitar el sitio web miamidade.gov We Can, We Will, y formar parte de esta campaña, compartir los mensajes en sus plataformas de redes sociales. A medida que nos acercamos a las vacaciones, los casos de coronavirus están aumentando en Miami-Dade y lo que hagamos ahora marcará la diferencia. Otra parte importante de esta campaña es que todos nuestros residentes tengan los recursos que necesitan para mantenerse seguros. Esta semana, el Departamento de Policía de Miami-Dade comenzó a repartir máscaras a nuestros residentes. Pequeñas acciones como esta, usar una máscara y asegurarse de que quienes te rodean tengan una máscara, son central en esta campaña para mantener a nuestra comunidad segura. Los invito a unirse a nuestra campaña compartiendo sus propios mensajes con la comunidad con los hashtags We Can, We Will y Podemos Lo Haremos. Gracias a todos por acompañarnos hoy. Espero trabajar con todos ustedes para ayudar al condado de Miami-Dade a garantizar que tengamos una temporada segura. Gracias.
Thanks, Mayor. Before we move forward, I'm just going to quickly share my screen just to show the new website and tell folks where they can find all the resources. So can you all see that? Okay, great. So this is now the coronavirus homepage on the county site, which you can access through miamidade.gov/wecanwewill. And then at the top of the page is a link to the communications toolkit that the mayor mentioned, which includes more information about how to get involved, how to share the resources, and then some draft social media posts we'll be adding to this toolkit and expanding as we go forward. And then all of the graphics that are available now here in all 3 languages, as was mentioned. So you can download all of those there. And the virtual meeting backgrounds will be here as well, so folks can download those for the future. And then all of our partners, which we're continuing to build out the list of partners on the campaign, so you can see those here, and of course reach out to us if you would like to partner on the campaign, and we'll include you. So I'll stop sharing, and then we can move forward with the program. So next, we'll hear from our Chairman-elect Diaz.
Thank you, Rachel, and very well done. I would have been all thumbs trying to get that screen up to try to do all that. But thank you for everything you're doing for us. And Madam Mayor, I want to thank you for you participating in all the meetings. And I know it's not easy. You have exactly what we're talking about, coronavirus. You and your husband, all we do is wish you the best, and that you continue a speedy recovery. And hopefully soon you'll be past this. So I also want to thank Commissioner Chairwoman Sosa, representing her today. I know I see two of my colleagues here, and I see many of our colleagues in different political offices, and of course, leaders of our community. I see the superintendent, see mayors, and representatives of all kinds, especially business community leaders that are here too. This is important to all of us in every angle, from everything from the pure health side to the hopefully speedier economic recovery. Everything that we're doing at this point is important. So, Madam Mayor, I appreciate you doing the meetings that you're doing up in the federal level and advising us and bringing that information down. As a commission, I would tell you that we'll work hand in hand with you to make sure that our citizens are protected in every aspect, and working together to hopefully make this a thing of the past in the near future. There's a lot of issues that we're going to be bumping into. There's some that we're addressing right now. It's not when the holidays now begin, because the holidays already began, and people have been going out and doing things and traveling and so on. It's important to get the latest information to them and truthful information so they could understand and be able to do the things that they're doing. It's hard and very abnormal for many of us, especially from our cultures, that, we're all about family during this time, and we're all about getting together, and we're all about sharing. And this is a moment that maybe because of the rise of this pandemic, it's not the best time to do that. So it's very difficult for others that are going through their loss of life of relatives and friends and family, and that are in very serious conditions. So while we all are working forward to find solutions and then betterment, I know there's people that have many thoughts and how they perceive and doing and their rights and so on. So this is not an easy situation. So I congratulate you, Mayor, and trying to work together to find the best solutions for all of us in our community. And I look forward once again to be working alongside with you, my colleagues, to make sure that we continue to get the information out and do the best we can for everybody. En español, brevemente quiero felicitar a la alcaldesa por estar con nosotros en un momento que ella también está enferma con esta enfermedad, pero está presente y está haciendo su debida orden como alcaldesa y echando para adelante en todo lo que se puede para que nosotros poder trabajar con ella como comisionado. Yo estoy aquí representando a la presidenta del Consejo de la Comisión en este momento, Rebeca Sosa, y mis colegas conjuntos que están aquí, varios de ellos, y buscando la forma de buscar las soluciones para nuestra comunidad que son importantes. Las cosas que significan cómo pueden mejorar para proteger nuestra salud y también protegerlo en la parte económica y volver a tener el sistema económico que teníamos en un momento. Para nosotros es sumamente importante trabajar en conjunto con la administración y buscar las soluciones adecuadas para nuestra comunidad. La comisión va a estar conjunto con ella en tratar de hacer lo mejor posible para adelantar el bienestar de nuestra comunidad. Ella está sacando un programa que se llama Nosotros Podemos y lo haremos. We can and we will. And yo creo que es importante para todos nosotros oír y buscar la forma de hacer las cosas apropiadamente. So, de nuevo, alcaldesa, muchas gracias. Y a todos los colegas míos que vienen de diferentes partes de la escuela, superintendente, todas las personas, los alcaldes de ciudades, los representantes, los concejales y comisionados de ciudades, y las personas, y también nuestros líderes de la comunidad médica que están aquí también con nosotros y están participando en ayudándolo con la parte científica para salir adelante. Para mí esa es la parte más importante que tenemos que mirar y trabajar en conjunto para llegar a una cosa, a un momento en nuestra vida que esto será algo del pasado. Muchas gracias. Thank you so much.
Great. Thanks, Chairman-elect. And now we'll hand it over to our school's superintendent.
Thank you very much, and good afternoon. Thank you very much, Madam Chair, Mr. Chair, and Madam Mayor, and to the honorable representatives on this call today for the opportunity to join you. Number one, I want to eagerly support the mayor's efforts behind the We Can, We Will campaign. And on behalf of our chair of the school board, Ms. Perla Tavares-Hampton, and our entire school board, there's nothing of a higher priority than the safety and well-being of our students, our employees, and obviously the community as a whole. That is why today we support the county's efforts in reminding the community how to stay safe in order to control the spread of the coronavirus as we head into the holidays through positive messaging. I keep saying that to the extent that we control the spread of the virus in the community, our schools will continue to be viable places for teaching and learning. I would also like to make a couple of significant announcements because the people who have made them possible are on this event. We have recently expanded our partnership with Miami-Dade County and Jackson Health Systems in response to COVID-19 and are firmly committed to keeping students and employees healthy during this pandemic. As you probably know, Miami-Dade County will now be providing COVID-19 testing for MDCPS employees and their families. That includes children ages 5 and older, free of cost at 3 sites in Miami-Dade County Public Schools. Since the beginning of the pandemic, our employees have had access to free COVID-19 testing at any facility they chose to go to free of cost through our insurance program. Then, as a result of high demand for testing during the summer months, and as a request of our school board, we opened 3 facilities for rapid testing, antibody testing in our school facilities. But now it's time to accomplish 2 things: rely on viable partnerships, particularly with the county and Jackson Health, and transition towards a much more accurate system of testing for our employees, with the convenience of these tests being administered in schools. And that is exactly what the county and Jackson are enabling. Beginning December 10th, the county will provide PCR tests at MDCPS employee test sites for the foreseeable future. In addition to that, I really want to thank Mayor Levine Cava and President of Jackson, Mr. Carlos Migoya, not only for their friendship and their support, but for going above and beyond. As a result of very productive conversations, we can announce that the county's newly appointed Chief Medical Officer, Dr. Peter Page, with whom I met recently, who is also the Chief Physician, Executive, and Chief Clinical Officer at Jackson Health, will now serve as MDCPS in a significant advisory capacity. We believe it is important for this community to stand together, stand strong, and speak with one voice when it comes to issues related to health, the well-being of our community. His guidance, which again will be free of cost to the district, will definitely augment the health expertise provided by our own ad hoc public health and medical expert task force. As I close, it is important also to recognize that prioritizing the vaccine for school personnel and expediting the stabilization of our community and our economy are critically important. That is why we continue to partner with community organizations in delivering messages to Tallahassee, including a recent letter to the governor and the state surgeon general, advocating for, number one, expanded testing for students in school sites with reliable and highly valid tests, in addition to the recognition of school site personnel as not only essential personnel, but also individuals, workers who are deserving of priority vaccination in our state. Unas palabras muy breves en español. Estamos aquí hoy para apoyar los esfuerzos del condado para recordarle a la comunidad cómo mantenerse seguros para controlar la propagación del coronavirus durante esta época festiva a través de la utilización de mensajes positivos por medio de una campaña Podemos, lo haremos. Me siento muy agradecido a nuestra alcaldesa y también al presidente de la Comisión del Condado por sus esfuerzos para recordar a nuestra comunidad las maneras preventivas que deben ser utilizadas para, claro, eliminar esta pandemia en nuestra comunidad. También tenemos mucho orgullo en anunciar una ampliada asociación con el condado y con Jackson Health como respuesta al COVID-19 para garantizar exámenes gratis en 3 planteles escolares proporcionados por el condado. Estos exámenes son PCR exams, los mejores, gratuitamente para nuestros empleados. Y por último, nos sentimos muy agradecidos también al señor Carlos Migoya y también a nuestra alcaldesa Levine Cava por establecer un nuevo protocolo que nos dará la oportunidad de utilizar el doctor Peter Page, el doctor médico recientemente nombrado por el condado, que también es el director médico ejecutivo y clínico en el sistema de salud Jackson, y ahora también servirá nuestro sistema público en una importante capacidad de asesoría. Lo estamos haciendo conjuntamente para el beneficio de nuestros empleados, de nuestros estudiantes y, claro, de nuestra comunidad. So once again, thank you very much, Madam Mayor, Mr. Chairman, and on behalf of the School Board of Miami-Dade, we thank you for this terrific partnership and these great areas of collaboration that will advance the well-being, safety, security, and health of our community. Thank you.
Great, thank you. And next we'll hear from Dr. Page.
Thank you, Rachel. Good afternoon, everyone. Excited to be here and excited to participate in this new launch of the Mayor's campaign for the county. First, I would like to start by thanking Mayor Levine Cava and Superintendent Carvalho for having confidence in me to serve as a medical advisor for 2 of our community's most important institutions, Miami-Dade County Government and Miami-Dade County Public Schools. There's never been a more important time than now for all of us to be more unified, collaborative, really in our response to try and combat this virus. We've done a lot so far. There's a lot more work to do. And I know we've said it over and over again, but it bears repeating. We really need the public to do its part in helping our community stop the spread of this virus. And that means masking, that means public distancing, that means appropriate and regular hand hygiene. Miami-Dade County, all of its municipalities, the school system, the hospitals, and the business community all have a shared goal of protecting every resident in the county. And that ranges from the most vulnerable in the nursing homes to every boy and girl whose carefree childhood has been dramatically impacted by the last 9 months. As the Chief Physician Executive and the Chief Clinical Officer for the Jackson Health System, I'm fortunate to have access to some of the nation's best and brightest clinicians at Jackson and at the University of Miami. And we stand ready to provide medical advice and guidance to our county and our school system leaders. In our county's hospitals, we expect the number of positive cases to continue to climb as we're now at that 10-day mark after Thanksgiving weekend. One of the things that keeps me up at night is that this expected uptick will coincide with the upcoming holidays of Hanukkah, Christmas, and New Year's. And our hospitals are once again going to be tested as they were over the course of the summer. But that can be prevented. I know it's hard to imagine a holiday season without large gatherings and celebrations surrounded by family, friends, and coworkers, but it's a sacrifice we must make. It's one that will undoubtedly save lives. On an exciting front, as Jackson anticipates the arrival of the COVID vaccine in a matter of days, followed immediately by the start of inoculating hospital workers throughout Miami-Dade County, we all should be encouraged that there is a light at the end of this very dark tunnel. We still have months to go before we're able to breathe a sigh of relief, but at least there is that light that we should be concentrating on, capitalizing on, and helping all of us to achieve, the end goal of this battle with this virus. If we each do our part and take responsibility for our own actions, we will come out of this as a stronger, more resilient, and more compassionate community. So once again, please encourage everyone to do their part. Thank you for this time this afternoon, and I look forward to connecting with you again soon.
Thanks, Dr. Page. Next, we'll hear from City of Miami Beach Mayor Dan Gelber.
Good afternoon. Before our community is vaccinated, communication is our vaccine. And it's so vital that all of us are on the same page, that we all lean into these practices that Dr. Page just talked about. I've been sort of confused by all this because during hurricanes, leaders tend to speak with one voice and one message. And I don't know why so much of discord and disunity has accompanied this pandemic. Our effort needs to follow the model of unity that has helped us and served us so well and protected us, frankly, in all these other types of challenges. So I want to first thank Mayor Levine Cava for her efforts to unify a very diverse county, and to our county commissioners and other leaders for their efforts as well. It's really our job to do that. I want to thank her for this forward-thinking approach as well. This pandemic has challenged us. It has exacted a horrific toll in lives and in livelihoods, but it's not going to change who we are fundamentally, namely a community that will always be resilient and profoundly optimistic. Our residents need to know how critical it is right now to protect themselves and their loved ones, especially during the holidays when we are so accustomed to gathering, praying, and celebrating the blessings of our life. I'm the mayor of a city that essentially has a crowd-based economy, for want of a better word. We like when people come here and get close together and hug and celebrate and converge and think about issues of their life. But right now, we have to change our business model a little bit. But I think that hearing us speak with a single voice and presenting a singular message, which is what this is really all about, will only encourage and promote these kinds of healthier and safer practices, which frankly we need right now more than ever. There's a surge, and people are about to do what they always like to do, which is gather and pray and be joyous during the holidays. But we've got to listen to the message that is coming from our health professionals, that we have to guard ourselves and our loved ones against the unnecessary or any spread of this virus in our community. So Mayor Levine Cava, thank you very much for allowing me to say a few words. And more importantly, thank you for your efforts to really get us on the same page so that our residents hear only the same thing, only the same approach, only the same message of health and safety and optimism. Thank you.
Thanks, Mayor. And next we'll hear from City of Hialeah Mayor Carlos Hernandez. Is the mayor on the call? Let me see. If
you hear me now?
Yes, we hear you.
There we go. First of all, I want to thank the mayor for, and I'm going to start by saying we can, we will, and the word is we. And it's really great to be here united. Something we should have been doing months ago, where we have the medical community here, the school system, local government, county government. So thank you for doing what should have been done many, many months ago. I'm not going to go backwards, but it is important that we give you that credit. And as united, we do have to send one message. From now on, it's one message. And as a community, we have to protect each other, even though I wish we could get more help from the state. And maybe somewhere down the line, we're all going to have to unite if this thing is the worst and make a statement, because those mixed messages that we're getting from the state, I think are making our job harder. So it is an honor for Hialeah to be united here with all the major cities, with the county, Jackson Memorial schools system, to say we can, we will, and together we'll get past these next couple of months, which according to science and the medical community is going to be very tough until we can get the vaccination to our population. Quiero dar las gracias a la alcaldesa por unirnos. Juntos podemos, y creo que esa es la palabra, algo que deberíamos haber hecho hace muchos meses atrás, y creo que esa unidad va a ser muy importante en los próximos meses para salir de estas semanas oscuras que dicen la medicina que se va a poner las cosas difíciles, y también va a ser una necesidad esta unión unidas, porque si esto empeora mucho más, vamos a tener que estar unidos para mandar un mensaje al Estado, donde el mensaje todavía es un poco confuso y ha confundido a muchos de nuestros ciudadanos. Así que gracias, y de verdad que me siento honrado de estar aquí, no solamente unidos con el condado, con el sistema de escuela, Jackson Hospital y las ciudades, algo que debería haber estado haciendo desde el primer momento, unidos desde que empezó esto. Así que un honor estar aquí, y gracias a la alcaldesa de nuevo por su liderazgo.
Great, thanks so much. And next from City of Miami, we have Commissioner Ken Russell on the call.
Thank you very much. Thank you, Mayor Levine Cava, elected officials, and others who are on this call. We can, we will is a beautiful slogan. We can overcome this pandemic because we will work together in a very transparent and forward public-facing way. This very call is a perfect example of that. And what do I mean by working together? The only way we can get the buy-in of our public to accept the public health policies that we need to implement is if we follow up those policies with the economic policies which we should implement to mitigate the effects of those health policies. And the only way to do that is when we work together at the various layers of government. The City of Miami is very thankful to have received the first $8.5 million of the CARES money that flowed through the county, which we've already deployed in small business grants up to $20,000 and $250 grocery cards. We thank the county very much for that cooperative work, and we look forward to doing more of that so we can help more businesses and residents who will come out of work when we have to implement policies that affect their lives. So I thank you all for your cooperation. On behalf of Mayor Francis Suarez, who wasn't able to be here today, I'm Vice Chairman of the City of Miami Commission. I'm happy to represent the city and thankful for all of you.
Great, thank you. And now I'll hand it over to Bill Talbert from the Greater Miami Convention and Visitors Bureau. # we can, we will, Bill, as it says on your Zoom. Thanks, Bill.
Yes, thank you, Rachel. I did rush out to the courts and legally have my name changed. We're so supportive of this effort, so thank you for noticing. Mayor Daniella Levine Cava, thank you for your leadership. I'm looking at a number here on the right of the screen here. It has a number 90. I don't believe there's ever been these 90 people together ever for these kinds of issues. So I applaud you. I think it's the we and the can and the will that's going to work, and working together. We've got folks from the north, the south, the east, and the west, schools and hotels, and all sorts of things. So we applaud your efforts. We're going to use the background, and it's all working together. I mean, our family on Thanksgiving, we went from 25 visitors to 2. So we're going to do the same thing for the rest of the holidays. So there are, and Wendy is here from the Hotel Association. You know, we have 56,000 hotel rooms. There are some people here safely traveling, safely. We do have staycations, and we're going to get out of this. Some of what we're doing is brand awareness in the world, just like others are doing. You see Disney billboards in town. So all I know is with this 90, and it's still the 90, the number hasn't gone up or down, but by working together and following the rules, we're going to get through this. Thank you for your leadership, Mayor.
Great, thanks, Bill. And next from the Greater Miami and the Beaches Hotel Association, President and CEO Wendy Clergis.
Thank you so much, Rachel. And Mayor Levine Cava, you look fabulous. I'm glad, so grateful for you to invite us. And I say us because we're going to share this with the entire hotel industry in Miami-Dade County. And congrats to our re-elected and newly elected government officials. It's really great, like Bill said, to be all together, working together. That's what it's all about. And that's what our hospitality industry has always been all about. Since the end of March, our hospitality industry have been wearing masks. They've been practicing social distancing and washing their hands, maybe even earlier than that. But I think that this is a wonderful campaign. Miami-Dade's hospitality industry, as you all know, have been hard hit by the economic crisis brought on by COVID-19. And we can't afford to suffer another setback as we head into this final stretch of the year. So that's why we're so excited to join the We Can, We Will campaign. We love campaigns. We're going to get with our HR directors to get with all the employees. We'll need some buttons, I think, maybe pins as well, because they do have uniforms. So, and then also T-shirts, and just working together to spread the word to our guests through the big, great partners that we have here. As you know, we work so well together. So we're really, really grateful for this campaign and just your efforts in such a short period of time. We're very, very, very excited. Whatever we can do to help support this, and we thank you so much from the bottom of our hospitality hearts for all that you have doing for us.
Thanks, Wendy. Next, we'll hear from Beacon Council President and CEO Michael Finney.
Thanks, Rachel. Thank you for having us today, Mayor Levine Cava. We really appreciate all that you're doing to move the community forward, especially given the crisis that we have. So much has been said by all the other government, community, and business leaders prior to me. But I do want to say that the Beacon Council, we've been working diligently over the past several months since this crisis started, really focused on helping our businesses and the local economy, and in particular small businesses, as they try and navigate this crisis that we're in. We've partnered with a lot of organizations throughout the county since March, just to ensure that our businesses can navigate this crisis as effectively as possible, because we know we can't afford to have another setback where everything is shut down. That's why the next few weeks are really pivotal, and why this campaign is so timely. Aimed at working together as one community focused on Miami-Dade's health, long-term recovery, and prosperity. The We Can, We Will campaign really unites business, government, our healthcare system, and others to really help us stop the spread of this pandemic and to protect our residents and businesses so that our economy can, in fact, continue moving forward. We're known for our entrepreneurial spirit. This is a community that's filled with large businesses and small. We're known for our creativity, and we're known for our ability to adapt and protect our staff, customers, and the community as a whole whenever we're dealing with critical situations like the one we face right now. This is an important time of year where we're accustomed to coming together to celebrate friends and family. The best way we can do that and take care of ourselves and each other, unfortunately, right now, is to continue to practice all the guidelines that's been provided to us by our healthcare professionals, by the CDC, and others who are focused on the science of this crisis that we're faced with. As Miamians, we know that we can and that we will make this happen. It's a campaign that really is built and aligns with the spirit that this community, I think, exemplifies. Again, on behalf of the entire Beacon Council organization, our board of directors, and the One Community, One Goal initiative, we're really excited to be a part of the campaign. And we just look forward to continuing to work as a part of the team that Mayor Levine Cava has assembled. And happy holidays to everyone.
Thanks, Mike. And finally, we're also joined by Greater Miami Chamber of Commerce President and CEO Alfred Sanchez, who will speak as well.
Thank you, Rachel. Madam Mayor, again, congratulations. Thank you for the invitation, and congratulations to our elected officials. I think Mike said it extremely well. We in this community have a resiliency streak in us. We have proven that time and time again through economic downturns, through hurricanes and all kinds of disasters. This is no different. This is no different. And we do that by coming together. I love the theme of this, we can and we will, because it really does embody the spirit that we have lived for decades upon decades. So I really congratulate you on capturing that genie in a bottle, Madam Mayor. And I think, the chamber's here to promote this campaign. I think what I keep telling my members is when they worry about, well, are we going to shut down again like California? I keep telling them, you know what? We are the ones who are in control of whether we shut down or not. And we can do that simply by following the guidelines that we know will keep us safe and we know will keep us open. So stop looking for others to do it. Do it yourself. And I think that is the message we're giving all of our members. And I'll end with, Shakespeare said, some are born great, some achieve greatness, and some have greatness thrust upon them. Well, this is all our moments to have greatness thrust upon us by helping the mayor in being able to achieve this very worthwhile goal. Happy holidays, everyone. Thanks again, Mrs. Mayor.
Well, I must say that was a very inspiring set of messages from all of you. And I know for those who are joining us but not speaking, it's also in your hearts. And I'm just very, very encouraged and inspired. Clearly, we form a great communications team. And as Mayor Gelber said, communications is our vaccine. And we did get a hold of a genie in a bottle here. And it's thanks to our communications team in Miami-Dade County government. And we've worked as well with the communications, the marketing teams of the various sectors that are represented here to check it out and get people's buy-in. And I just want to give a big shout out to our communications team for putting this beautiful campaign together on very short notice, very Miami-centric colors, also meant to appeal to young people who are sometimes harder to get through to. But for all the young people and all the young at heart, this is a campaign for you because it is truly on us getting through this together. And out of every great crisis comes opportunity, and that's what we're seizing here today. So that's it for the formal remarks, and we're open to questions.
Great, thanks, Mayor. So please go ahead and put your hands up in the Zoom, and we'll try to get to as many questions as we can. First, we have a question from Ben Conark from the Herald.
Hey, thanks for taking my question. This is directed mostly towards Superintendent Carvalho. We've been asking the school district about this, but the testing sites that have been up since October have been using an antibody test that's not really a diagnostic. They're more designed to detect past infections than present ones. We spoke to the company and they said that they offered PCR testing to the school district, but the school district went with antibody testing instead. Could you help us understand why that decision was made?
Sure, thanks for the question, Ben. As I said earlier, since March, we have, through our self-insured platform as a school system, provided for all employees and their dependents free PCR testing or any type of testing at any authorized medical facility. So that was something that already existed. Simultaneously to that, the county had its own testing facilities. The problem was there were long lines at that time. So we wanted to provide an additional type of test, an additional opportunity that was rapid in its nature, never eliminating the access to PCR testing that our employees had access to for free. And we made that announcement back in March. We recognize the limitations that this type of rapid testing that is currently being offered carries. And that is why we've been working on solutions, in part, obviously driven by conversations with the board and board discussions, but looking for solutions that would amplify the opportunity and the accessibility. And that's why today's announcement of 3 sites for PCR testing free of charge based on the partnership with the county and Jackson Memorial is so crucial. And it is our intent now that there is capacity and availability, while not discontinuing the availability of PCR tests for free at any medical facility through our medical program, but making 3 sites now available at schools as well, with the end goal of completely discontinuing the current engagement with the entity that provides the antibody tests. We've always recognized that they fall short, particularly in the area of false negatives. And I think now with this partnership, we close the loop of protection for our employees.
Thanks.
Just a quick follow-up on that real quick, and then I promise I'm done. But just on the false negative question, I mean, are you at all concerned that you provided a false sense of security for people, or there was a lack of clear communication about what type of tests these were? When you describe them as rapid testing, I mean, that's something completely different in my mind. That is antigen testing, which I think they've also been described as. But antibody tests, once again, are designed to detect a past infection. So by the time you test positive on an antibody test, your infectious window is most likely to already be over. So
both, yeah, thank you for the question. I understand the question. So both antibody and antigen testing are rapid in nature, and they both fall short of the gold standard, which is the PCR molecular testing, both antigen and antibody. So look for the, as I said earlier, the rapid antibody testing was one school site model that was available, but it did not replace the availability of PCR tests free of charge for all employees through our self-supported insurance company at no cost to employees. And we marketed that opportunity going back to March. Secondly, at the antibody test sites, which currently there are 3, individuals who were tested there were provided with information and were apprised of the fact that if they had symptoms but they received a negative test, they should get a PCR test, which carries with it, as I said, the higher level of efficacy that they would need. So there are many different opportunities in our community, whether provided by the county at various sites, medical providers through our own self-insured platform, in addition to those antibody rapid test sites. But again, we have evolved, and we're now in a position of actually eliminating it and replacing it with a free approach of PCR test at the 3 sites to begin with, based on this new partnership.
And Ben, if I could follow up on the superintendent's comments, this is a rapidly evolving process, the testing process, the antibody testing process. We've been through a lot of different iterations. I think that there are different formats for different tests, but as the superintendent alluded to, that core testing was not taken away. It was added to by having the antibody testing available. You're right, antibody testing typically, represents a prior infection and your body's response to it. But we're seeing a lot of progress now in the antigen testing as well. And obviously the PCR, has been a staple for us over the course of time. So I think that what we need to do is just be constantly looking for opportunities to come up with the best testing platform and constantly watching for, positive changes in the testing platform that we're seeing on a pretty continuous basis.
Thanks, Dr. Page. We're going to go ahead and move on to Colleen Wright from the Herald, who has a question as well.
Hi, thanks for taking my question. This question is also for Superintendent Carvalho. And I really do want to follow up on what Ben was talking about, not to beat a dead horse. But I'm just wondering, if the school district had the option through a NUCO to have a PCR test, why wouldn't the school district just take up a PCR test? And because if someone shows up with symptoms and tests negative, you're kind of wasting your time. They could have just gone straight to a county site or really anywhere else, maybe through their insurance provider, since it's covered. So I'm just wondering why the school district didn't just pick up a PCR test when it could with a NUCO.
Yeah, so as I said earlier, we already provided an opportunity for our employees and their dependents to have access to a free PCR test at any site of their choice beyond the free sites provided by the county in medical facilities through our self-insured program. What was lacking at that point was a rapid, expedited means of detection, recognizing the shortcomings and limitations. So that was, at that time, the thought process. But as Dr. Page said, look, this is the pandemic, the coronavirus, and the mitigations against it, the diagnostic tools, testing, and ultimately the vaccine this is something that's been rapidly evolving, and we as a school system have made decisions based on what was available to our workforce and what was lacking. So for us, our theory of action then was not just an either or proposition, was a both and. Employees and their dependents had access to PCR testing at any one of the county sites for free, or, as I said, in the comfort of a medical facility with costs fully absorbed by the district. What was missing at that point was an expedited, fast way of getting certain information, recognizing that particularly because of the rate of false negatives, if somebody went to get tested and they in fact were experiencing some symptoms, then an automatic recommendation for a PCR test was made.
Okay, I just know that the school district had an option and chose not to go with it. But I also have another question about Dr. Page, but this is for Superintendent Carvalho. Is Dr. Page now the Chief Health Officer? I'm sorry? I just want to ask about the Chief Health Officer position at the school district. Is that still a position you're looking to fill, or does Dr. Page fill that position?
Yeah, so after 2 attempts at securing a Chief Health Officer, and this was the conversation I had both with the mayor and the president of Jackson Health, Mr. Magoya. After 2 attempts at capturing the talent that we felt we needed, which resulted, quite frankly, in not the right fit for our school system. We did 2 cycles of recruitment. It occurred to me, based on recent announcements, that maybe the system would be better served through someone who is local, who is an expert, who has access to immediate resources in our community and immediate information. And it made sense for us to at least explore the possibility of relying on the advisory capacity that would be provided by somebody of the caliber of Dr. Peter Page. So based on conversations I had with both the mayor and Mr. Magoya, not only will we be benefiting now from this really in-depth partnership with Dr. Page, but also with his staff, which is something that I think exceeds what we would be getting from a single entity should we hire that person. Secondly, it makes prudent sense since it is a cost savings for the district if we do not have to, in fact, invest in another position and still get the appropriate advice that our school system needs. We are blocks away, and based on the preliminary conversations I've had with Dr. Page and Mr. Magoya, I think it will be a terrific partnership that advances not only the best type of advice we could get as a school system, but also provides us with an opportunity to continue to consider and contemplate actions, not just in a silo, but in collaboration with other governmental entities in our community.
So you are still looking for
like
a Chief Health Officer?
Excuse me, I just
Sorry,
want to add.
Kristen, no, we're going to, Colleen, we're going to let the mayor speak and then we're going to move on to the next questioner. Go ahead, Mayor.
Okay. Yes, I just wanted to say that this was an idea that I fully embraced for the very reason that we do need to speak with one voice across the county. That's why I'm so excited. The number of mayors, elected officials, business leaders that have all joined hands with a single message. This is how we are going to get control of this virus. Dr. Page brings a full complement of other experts within the Jackson Health system to bear. And I think it just makes total sense that the school system would be working in collaboration with the county in Jackson.
I just want to understand if the district is still looking for a Chief Health Officer or not.
Colleen, sorry, we have to move on to the next questioner. We only have a few minutes left, so we're going to take questions on the campaign. I think I have Christina Vasquez's hand up.
Hi, good afternoon. My question relates to, we know the governor has doubled down on his decision to not issue a statewide mask mandate that's been throughout the pandemic, and really his decision to not support Miami-Dade's mask mandate in essence with that September order that he extended in November. So while I definitely hear from you all that it sounds like this community-wide campaign, the idea here is, you know, to put various community stakeholders under one umbrella. So if you live in Miami-Dade County, no matter which way you look, you're getting that unified message. That said, what efforts do you plan on doing, or do you think still needs to be done in terms of getting a hold of the governor and in this ongoing effort from the local mayors to seize back some of the control over mitigation tools like capacity limits, like collecting fines for individual mask mandate violators since he extended that September order in November?
Let me be clear. We are enforcing our mask order. So that is part of one of the tools in our toolbox. And while we can't collect fines at this time, we can issue civil citations and we can collect the fines later. We are focusing on getting people to do the right thing, but that is coupled with enforcement of our mask mandate as well.
Great.
Thank you for that. But I heard Mayor Hernandez kind of make that reference of, perhaps this is the 90 people on this call, this kind of another unifying moment to kind of continue to press the governor on the needs here in South Florida. So,
I just want to be
Madam
clear. I think the governor knows that that's the desire of this community, and we are doing our part to enforce what we have in place, which is our mask mandate.
Great. Thanks, Mayor. We're going to move on to the next. We're going to move on to the next questioner. Sorry, we're trying to get to as many folks as we can. Erica Carrillo has a question as well. Erica, I think you have to unmute yourself.
Hello, can you?
Yeah, we hear you.
Thank you. Mira, esta pregunta es en español. Se la quiero dirigir a la alcaldesa y también a el comisionado Ken Russell, no sé si todavía está ahí, de la ciudad de Miami. Y la pregunta es la misma para los dos. También si el alcalde Carlos Hernández me la quiere contestar, también igual. El fin de semana, Univisión, ayer vi que Canal 10, otros canales, hemos estado mostrando imágenes de unas fiestas a las 2 de la mañana, a las 3 de la mañana, en violación del curfew. La alcaldesa dice que están enforzando el curfew. Ciudad de Miami, el alcalde Suárez dijo que él no cree en el curfew. ¿Cómo vamos a hablar de unidad cuando, por un lado, Ciudad de Miami no ve una conexión entre la violación del curfew, las fiestas en la madrugada, donde se ven cientos de personas sin máscara, sin distancia social? Y quiero igual, en Hialeah no sé cómo está la situación, pero ¿va a haber algo o no para decirle un mensaje claro a los dueños de bares y discotecas? Ustedes no pueden tener 100 personas metidas en una discoteca sin máscaras, porque nada les pasa. Ninguno de esos lugares ha sido cerrado y están haciendo las fiestas como que aquí no pasa nada porque no hay policías tampoco enforzando eso en las discotecas.
Bueno, puedo decir que
Gracias.
tenemos la toque de queda enforzado por los policías del condado y las ciudades están también participando. Y de la ciudad de Miami esperamos que van a cambiar su posición esta semana. Y mientras todo, ellos también están enforzando de las máscaras y distancia social. Pero estamos siguiendo enforzando toque de queda. No sé si
Sí, te puedo contestar también. Gracias, Erika, y gracias, alcaldesa. Yo hablé hoy con el alcalde Francis Suárez y también esta semana con el presidente de Jackson Health System, Carlos Migoya, y sabemos que tenemos este problema de personas sin máscaras en grupos, pero ya yo vi personas en estos grupos sin máscaras a 9 de la noche, 10 de la noche en restaurantes y bars también. Nosotros pensamos que no solamente es la hora, es la policía, es the policy, de que si los restaurantes van a enforzar y la policía van a enforzar estas reglas. Pero más importante para mí, tenemos cosa más importante es la salud del público. La responsabilidad que tenemos a los negocios es para seguir después de las reglas con la ayuda a los negocios. Entonces, queremos pedir al condado para un cooperation económico y también de la the policies of health. Entonces, si podemos hacer algo así para ayudar a los negocios también, yo puedo hablar con los comisionados en la ciudad también, porque sabemos que es importante que somos unidos en este programa.
Thanks. We have a question from Andy Slater.
My question is for Mayor Levine Cava. You mentioned last week that you were sending a letter to the governor, and I was wondering what changes, business-wise or anything else, are you looking to make? Because I know you said part of that letter would be to regain control and be able to make changes.
Correct. So the idea of the letter was with the city mayors. So we're still in conversation with the city mayors as to exactly what additional we would say, since the desire to have more local control is something that's already been expressed. But basically, we are concerned that if we reach a certain point, that local counties should have more say in implementation of local rules.
Is there anything specifically, though, that you are looking to change if you do get that control back?
Well, I think fines would be good, rather than waiting. But again, we do have the means to implement requirements around the masking, and we're doing our best. All the cities are following that and enforcing the masking rules and the distancing rules as well.
Thanks, folks, for staying on a couple of minutes late. We just have 2 more questions that we'll get through. So we have a question from Doug from the Herald.
Hi, thanks, Mayor. County police issued no individual mass citations in November, and the courts don't show any mass citations coming through their files yet. Can you give us some details on what's changed regarding enforcement of the mass citations?
Yes, thanks, Doug. So I've been mayor for 3 weeks today, and we have revisited exactly the enforcement methods, and we are starting with aggressive mask distribution, and it is coupled with citations for those who refuse. So hopefully we will be able to keep the enforcement side down as much as possible and focus on, with this campaign, the positive following of the guidelines.
Thanks. And we have a question from Elaine DeValle as well.
Okay. Can you hear me?
We hear you.
Okay. My question is for the mayor and I guess also Dr. Page. Coming on the heels of the news that he's now also going to be the chief medical officer at or in a similar role at the school board. I welcome that. I also am of the understanding, and please correct me if I'm wrong, that there's no salary attached to this with the county, that he's still going to be full-time doctor at Jackson Memorial Health. So what exactly does the role entail, I guess is the first part of the question. And the second part of the question is, and I don't mean to say this in a bad way, but in my lingo is like, where has he been? Why is this happening now? And why haven't we had that kind of role, if you will, earlier in this crisis?
All right, thanks, Elaine. First of all, we're very, very privileged and honored that President Migoya has made Dr. Page available to us, and that Dr. Page has made himself available and reassigned duties as needed to be available. And I have been in contact with Dr. Page daily, so he is weighing in on all kinds of issues or matters that come to our attention. He's participating in a number of calls, Zooms as needed. Obviously, we try to streamline that, but we've also spoken to the superintendent about what level of support would be needed, and we feel very confident that Dr. Page, along with the other experts, will be able to do the job. What has happened up until now, of course, I was not the mayor, so I can't speak directly, but I can tell you that there are many experts within the Jackson system, FIU, and elsewhere who are still part of the team. But what we have to our great advantage with Dr. Page is a single point of a spokesperson, basically, to assist us to always make sure that we're all on the same page with Dr. Page.
Thank you, Madam Mayor. The only thing I would add, I would just say that, you know, obviously, as I mentioned previously, it's an honor and a privilege to be in this role and be chosen for this role. But it is a new role that was created, I think, at least from my perspective, in an effort to try to align more components of the community with a kind of a little bit more of a focused path where we're all trying to work together and we're all trying to support each other. As the mayor alluded to, I have access to some of the top specialists in a lot of different disciplines between Jackson and the university. We also have a pretty collaborative group across South Florida of CMOs, and we also work with the CEOs across multiple health systems across South Florida as well. So, you know, I'm going to be drawing on a lot of those resources as well to help support, you know, whatever I can for both the mayor and the superintendent.
Thank you very much. Thank you.
That wraps up all our questions today. So we'll go ahead and hand it over to our Haitian Creole translator to close us out.
Thank you, everybody.
Thank you very much. Bonjour, ici département de communication comté Miami-Dade. Nous parlons pour vous déclaration maire Daniella Levine Cava, soit fait dans la langue anglaise et espagnole. Bonjour, merci d'être nous avec moi aujourd'hui pour nous lancer campagne, nous capables, nous privés, pour nous qui résidents nous en sécurité pendant la période de saison fête là. J'aimerais toujours dire en réponse à la pandémie, ça, il y a un plan de protection unifié à travers tout service dans le gouvernement et ensuite à travers les leaders communautaires, l'important en pile. Moi, assez fier aujourd'hui que la campagne, ça va le mettre nous ensemble avec autant de grands leaders que nous avons dans la communauté noire. Nous sommes capables, nous privé, nous piquer devant ces efforts de communication collaborative que l'administration moyen, tout département dans le comté, tout leader qui est lié, business, avec leader santé, et puis résidents nous, pour lancer comme message positif pour être capable d'assurer sécurité tout le monde pour prévenir propagation COVID-19 là dans la région noire, pour capable de célébrer les résidents avec business qui a fait bon bagaille, motiver la communauté noire pour être capable de jouer bel espace parc que nous gagnons pendant la période fête là. Nous allons travailler ensemble avec tous les partenaires, à travers toute la communauté, pour nous lancer des messages qui sont des messages qui sont nouveaux. Ressources disponibles dans miamidade.gov/we can, we will, dans la langue anglaise, espagnol et créole. Dans le jour qui parle venir jusqu'à la période fête là, nous allons partager vidéo tout court les deux communautés qui parlent bailler histoire qui tout court pour façon pour nous adapter aux nouvelles circonstances et puis pour nous capables de lutter ensemble. Nous encourager tout le monde à aller sur le site internet là, télécharger les ressources qui sont disponibles et puis partager l'histoire personnelle nous tout sur internet. Pendant la période ça, qui est la période fête, le coronavirus là, a augmenté en pile dans le comté Miami-Dade. Et tout le monde qui est capable de faire ça, est capable pour empêcher ça d'arriver, pour faire une grande différence. Je connais que je répète ça souvent, mes répétitions toujours bon. Nous avons vraiment besoin de participation publique là, pour être capable de jouer le rôle pour aider la communauté noire à arrêter la propagation du virus. Vous mettez masque, une distance sociale, pratiquer bon genre hygiène pour moi. Tant pis suivre étape ça pour nous capables de rester en sécurité. Moi, invitez-nous pour nous capables de mettre coller dans la campagne ça, pour nous envoyer message nous dans la communauté, de nous utiliser hashtag we can, we will. Merci en pile de ce que nous venons pour te coller avec moi et nous allons travailler ensemble dans le comté Miami-Dade pour nous assurer que nous gagnons une bonne saison fête et pour nous entrer en 2021 sans danger. Merci.
Great. Thanks, everyone.